Our mission is to promote the health and well-being of South Asian communities in the United States through our advocacy work, collaboration, and communication work. And so what that means is, or how we do that is we advocate for South Asians on priorities that impact their health. We also foster partnerships and collabs with organizations, professionals, and community stakeholders. And we also communicate any sort of current and relevant South Asian public health knowledge, as well as research about South Asian Americans and any gaps in research and understanding about South Asian American health. And if you want more information, you can visit us on our website, safa.org. Some intentions and agreements for today's workshop. First is that we're going to try our best to be present whilst being responsive to our own needs. So this can mean if you're able to be on camera, great. We would love to see your faces. But if for some reason you're not, that is also totally fine. We also want to respect folks' pronouns and be mindful about our assumption about people's identities just to foster a more inclusive environment. We will also center learning, curiosity, and growth, just because we want to make sure there are no stupid questions. If you want clarification on anything, or if you have any sort of comments, feel free to share in the chat. And last but not least, we will engage in whatever way feels most comfortable for us, whether that means sharing off mute or raising your hand or sharing in the chat or not sharing at all. You're welcome to do or participate however you would like or however you can. Last but not least, SAFA's land and labor acknowledgement. So I'd like to invite folks to review this land and labor acknowledgement on their own. But just to summarize, we at SAFA recognize that the work that we do, the people that we serve, where we work, and the institutions that we work within have all been built upon the backs of forced labor and the enslavement of those of African descent, as well as on the stolen land of indigenous communities. So before we do the work, we must acknowledge this history and legacy and also acknowledge how this impacts our understanding of health and justice, and also approach our work with this lens of decolonization and dismantling oppressive forces in society. So I'm going to introduce our speaker real quick, and then I'll turn it over to them because they have a lot of information to get us through. So Sydelle is a dedicated and creative policy and advocacy professional who is committed to the collective liberation of all. Sydelle began her career in education policy, where they worked on issues such as diversifying the educator pipeline and fighting for thriving wage for childcare workers. Prior to joining NAPAWF, which is where they're currently at, they served as the Assistant Director of Federal Policy at SECUS, Sex Ed for Social Change, where I had the pleasure of working with them, where they champion inclusive and evidence-based sex education. Sydelle is deeply passionate about fighting for a world where marginalized folks are affirmed in their identities and they have the power and information they need to make decisions about their own health and well-being. Sydelle is a proud 1.5 generation Indian American who was born in Mumbai and raised in New Jersey. They received their BA in political science and economics from Northeastern and their master's in philosophy and social policy from George Washington University. And with that, I will turn it over to Sydelle. So I'm going to stop sharing my screen, so feel free to get started.
Thank you so much, Nawal. If everyone can just give me a moment so I can share my screen and then we can get started. Okay, can y'all see that? Great. Okay, thank you everyone for making time on a Thursday evening for a presentation around economic justice, which is a really fun and exciting topic. Before we jump into the actual workshop, I just wanted to share a little bit more about NAPAWF, which is the organization that I work for. NAPAWF is the National Asian Pacific American Women's Forum. We're the only multi-issue community organizing and policy advocacy organization for AAPI women, girls, and gender expansive people in the United States. And so we work to build power and create change by focusing on three key issue areas. So firstly and foremost, we are a reproductive justice organization, and I will go into exactly what that means. But that means our kind of first key issue area is reproductive health and rights, to work towards the freedom to make decisions about our bodies, sexuality, and reproductive health. Secondly, and why I'm here today, is economic justice and equal pay for AAPI women and families to thrive. And then lastly, immigrant rights. So families are able to access quality and affordable health care regardless of their immigration status. And so, our goals for the conversation today are firstly to connect public health and economic justice, to really understand how things like access to healthcare, childcare, and fair wages are all really critical to public health and economic justice. Secondly, because we are obviously here to talk about the South Asian community, we will highlight impacts to the South Asian community and talk a little bit about how systemic racism, gender norms, and immigration issues all shape our community's experiences with injustice. And then lastly, we will do this little advocacy exercise, talk a little bit about what threats there are currently happening at the federal landscape, and then learn how we can start to take action. So, as I mentioned before, I did want to quickly define reproductive justice. I think it's one of those terms that's like often tossed around and it's not always clearly defined. So we're all on the same page. Reproductive justice was a term coined. They just celebrated its 30th anniversary last year in 2024, and it was a group of Black women who came together with the understanding that their needs and experiences were not represented by the mainstream feminist movement. And so they created this whole concept of reproductive justice and the reproductive justice movement to specifically speak to the experiences and challenges of being a Black woman, and then also for women of color, trans people, and other marginalized communities. And so reproductive justice is the human right to maintain personal bodily autonomy, to have children, to not have children, and to parent the children that we do have in safe and sustainable communities. So it goes far beyond just, the right to access contraception or abortion, even those are, critical aspects. So, just talking a little bit about how economic justice and reproductive justice are connected. And some of this may be obvious to many of you, but I'm still going to go over it. So, firstly, the building blocks of economic justice, things like income equality, affordable housing, food justice, these are all socioeconomic determinants of health. So, these are factors that are going in to determine essentially how healthy someone is. But they are also the building blocks of what economic justice might look like. Seems obvious as well, but people with lower incomes often lack health insurance or cannot afford quality healthcare, medications, or preventative services. And obviously, from the reproductive justice angle, this includes access to contraceptives, preventative reproductive health care, and abortion. And so, lastly, restrictions on reproductive freedom reinforce barriers to economic justice and vice versa, which I think is an important relationship to highlight. And I do want to share just a couple of statistics just to kind of illustrate that. So, abortion restrictions have been shown to lower the likelihood that a woman will graduate from school, and that includes both high school and college, and will lower their overall lifetime learnings. In states where abortion is banned, women work more hours per week and have a lower income. Additionally, states with abortion restrictions or total bans have lower minimum wages. Many states that banned abortion after the Dobbs decision also have the biggest gender wage gap. And then lastly, which will tie into some of the things we'll talk about today, because of the Hyde Amendment, which prevents the federal government from funding abortion, essentially means that abortion cannot be covered by Medicaid. That means that abortion can effectively be banned for low-income communities unless they're able to pay for it out of pocket or have alternative financial resources. Ooh, second. So, now talking about how this relates to our communities. And so, without access to those building blocks of economic justice that I mentioned before, living wages, affordable housing, healthcare, childcare, people, especially South Asian women, queer, and trans individuals, are going to face limited choices about if, when, and how to start or raise their families. And, all of us read the news. We are facing a massive surge in threats, not only to abortion access being stripped away, but the rising costs of care and stagnant wages have specifically hit immigrant and working class communities the hardest. And then lastly, South Asian families often face added stigma, legal precarity, and cultural silence when it comes to reproductive health. And so I'm not going to go into the super detailed wonkiness of this, but I do want to just quickly cover at a high level what are the current most eminent threats to both reproductive justice and economic justice. So there's currently a case in front of the Supreme Court that would they're deciding whether it's allowed to deny Medicaid funding to Planned Parenthood. Planned Parenthood is kind of the face of this particular court case, but this would have impacts for many other community clinics that provide family planning services. And so the way that this connects to our community is if this were to decide that Planned Parenthood could not receive Medicaid funding, this would reduce access to affordable health care for low-income individuals, including many South Asians. Then we also have the Supreme Court case on birthright citizenship. And so this is based on an executive order from President Trump that aims to end birthright citizenship for children who are born in the United States to non-citizen parents. And if it ends up being upheld, that could lead to 150,000 children annually being stripped from their citizenship, resulting in them effectively being stateless. And the concept of stateless babies is just a very terrifying phrase. And so this obviously deeply impacts immigrant families, including obviously South Asians. And then lastly, Congress is currently going through their reconciliation process, which for those who don't know, it's essentially how they decide how much money funds the government and what programs that money should be allotted to. And so the House just passed their version of this budget, and it includes some really scary proposals to deeply cut social safety net programs and reduce immigrant access to essential programs. So overall, Medicaid is going to be cut by about $800 billion. We are also seeing, SNAP and other social safety net programs being cut, the implementation of work requirements. But then more specific to immigrant communities, there's provisions that would deny the child tax credit to children if one parent has an individual taxpayer identification number, which is if you are not a citizen, instead of a social security number, you have an ITIN, and then making permanent the exclusion from immigrant children with ITINs. And the child tax credit is an extremely effective anti-poverty tool. It's shown to support families. And so this is essentially denying immigrant families from something that could support their economic mobility. Secondly, limiting affordable care access and tax credits to green card holders and COFA migrants, which is just a specific group of countries, it's a specific visa status, which means that millions of lawfully present work authorized immigrants would not be able to purchase healthcare via the Affordable Care Act. Couple more things, restricting Medicare eligibility in the same way for lawfully present immigrants who with long-term work history. So this means that they have done, I believe it's 10 years of working in the United States, or there's a certain number of quarters. So they've worked in the United States, they've paid their dues, but now they might not be eligible for Medicare once they retire. And then lastly, the government wants to potentially penalize states that have chosen to use their own state funds to extend healthcare coverage to undocumented immigrants. And so the way that this would work is essentially if a state decides that independently of federal funding, they are going to make sure that their state Medicaid program does provide an option for undocumented immigrants. And for some states, they specifically do it for pregnant women and children. And they would also be implicated. I think it's about 33 states that would be affected by this, which is more than half. And so be punished by if they offer this option, the federal government would essentially reduce the amount of federal Medicaid funding that they give to the state. And of those 33 states, I believe there's about, I think it's five or six that have trigger laws, which essentially means that if a specific Medicaid program, such as one that provides health care to undocumented immigrants, if funding is reduced, that means that they eliminate the program altogether. So this not only will result in some programs for undocumented immigrants being cut, but funding cuts for Medicaid affect everyone, regardless of your background, regardless of whether you're born in America. If you are on Medicaid, you will be affected by these funding cuts, unfortunately. Sorry, I keep clicking it twice. There we go. Now that we've kind of talked about the landscape of threats, I do kind of want to talk about issues that are within our communities. And I think income inequality is something that is very important to discuss when we're talking about economic justice in the South Asian community. Income inequality is greater among Asian Americans than any other US racial or ethnic group. And I personally think that's a very stark statistic. And Sri Lankan and Pakistani Americans, so within their ethnicities, households in the top 10% had more than 13 times the income of those in the bottom 10%. And then if you look at the graph here, this is household median incomes for different South Asian groups. And as you can see, there is a wide range in median household income. So we have Indian households at, over 120,000, and then Nepalese, Bangladeshi, Bhutanese at half that. So that is a pretty significant disparity. And while we're talking about internal inequalities, especially given that NAPAWF specifically supports AAPI women, I have to talk about the gender wage gap. The wage gap varies very widely across different ANHPI ethnic groups. And unfortunately, due to the way that federal data around wage and income information is disaggregated, a lot of people will just cite the overall statistic for AAPI women, but not reveal the different disparities that come between groups. And so, while some groups, such as Indian women, do not actually have a pay gap, at least overall, when compared to white non Hispanic men, other South Asian ethnicities do face stark disparities. The wage gap for Nepalese women is 62 cents, and for Bangladeshi women, 72 cents. And there's other AAPI ethnicities that earn even less. This adds up to a lot of money over your career. And so, even again, within many communities, there's still a gender disparity. So, if you take away the race aspect, there are still differences in wages. So, Indian women, while they make $1.28 for every dollar paid to white non-Hispanic men, go us, but they make just 75 cents for every dollar paid to Indian men. So, you still see that there's still a gender disparity, even when race and ethnicity are equalized. So we're going to transition to our advocacy exercise, and we'll drop a document in the chat. I'm not sure how many people we are, 12 minus me, so that's 11. Um, Amal and Nawal, what do you think is the best way to divide people up?
Let me see. Or Anil, do you want to check on your end? It'll probably just automatically divide, but then we can also participate in the breakout groups.
Okay.
Would you like two groups with them working on two case studies or one?
Yeah, let's do that.
Okay, sounds
I'm
good.
not going to participate because I made the stories. That would be unfair.
That would make sense.
We're gonna pause the recording. Um,
See how the most important thing I think lesson to learn is that, at least from my perspective, is that building solidarity is the only way forward. And so even though all four of those people had very different backgrounds, they came from different countries, they had different levels of wealth, they were different ages. But ultimately, their struggles are all interconnected. And so, when we're talking about reproductive just injustice or economic injustice, those things don't exist in complete isolation, right? They're tied to racism, to xenophobia, to patriarchy, to capitalism. And so, while our communities are impacted, especially like people with backgrounds like Leela and Nazia, there's also many of us, like Samir, who have the power to show up for others who are facing those systemic issues. And through solidarity, we're able to build collective power. Like many voices is always going to be louder than one voice. And I think it's especially powerful when those people don't necessarily have a ton in common, because it means that they're coming together not necessarily out of self-interest, but they're looking at the bigger picture. And when we share resources, stories, strategies, that is going to strengthen all of us. And not just within the South Asian community or even the AAPI community, but building these cross-movement relationships and building solidarity between, our different ethnicities, and then also more broadly across all working class and historically marginalized and under-resourced communities, including Black, Indigenous, immigrant, and queer organizers. And so we talked a lot about the problems. And so now I want to talk a little bit about what would achieving economic justice actually look like? Because economic justice is such a multifaceted issue, I just want to talk through a little bit about essentially all of the policies that would go into achieving economic justice for our community. So, kind of first bucket is labor rights and dignity. So, protecting low-wage South Asian workers, especially those who are in gig workers who are working under the table in more precarious employment from wage theft, unsafe conditions, a lack of benefits. And then addressing the exploitation of undocumented or precarious workers who do not have the same resources to go and, complain to the government if their boss is, stealing their wages. Then advocating for workplace policies like paid sick leave, minimum wage enforcement, and then also raising the minimum wage. Supporting paid and unpaid caregivers. In our communities, uh, there's a lot of pressure on people, especially women, to be caregivers. And so we want to acknowledge and make sure that not only the unpaid caregivers in our family, but also paid caregivers have access to the resources, they're paid fair wages, because we want to make sure that families are able to access affordable, culturally responsive care. And for unpaid caregivers, the goal is to have care be a choice and not necessarily something that they have to do because there's no other care available. Then the next bucket is immigration justice. So ensuring fair and timely pathways to citizenship and work authorization, opposing public charge rules that deter South Asians from accessing healthcare or housing support. And for those who may not know, public charge is essentially the idea that if you are an immigrant who uses any sort of social safety net program, then you may not be eligible to get your green card to become a citizen because they view you as like, oh, you're a public charge, you're just taking advantage of the government and you're not contributing anything, which we all know that is not true. And then protecting refugees, asylum seekers, and international students from legal and economic precarity. We've been seeing a lot of a lot of international students currently facing, visa issues, having their visas revoked, and they don't have pretty limited legal recourse. And then caste equity. So recognizing and dismantling caste discrimination, however it may show up for you. I think there often needs to be a reminder that the South Asian community is massive in the United States, right? Like we are one of the largest immigrant communities. And so caste discrimination is not something that was left back in our home countries. Unfortunately, it's something that we've imported with us. And I also think caste discrimination has now been overlaid with the other forms of discrimination that have already existed in our country. And so there are several states that have, California, I believe, in particular, there's been fights at the state level to have caste included as a protected category in civil rights and employment law. And I think this is something that's particularly difficult to advocate for because it is a culturally specific issue. But like I mentioned before, like all these different forms of oppression are intertwined. Caste equity is not necessarily a different issue than immigration justice or wage justice. Then healthcare access, right? Like if you are not healthy, not only just reproductive health care, but just preventative care in general, you're not going to be able, you may miss days of work. You may not be able to find a job because your health doesn't allow it. And so expanding access to affordable, culturally competent care for South Asians across class and immigration lines is essential. Right now, there are many restrictions on being able to access Medicaid, Medicare, and the Children's Health Insurance Program, or CHIP, based on your immigration status. So even if you have a green card, you're a legal permanent resident, there's a 5-year waiting period for those programs. And in those 5 years, you may not be working a job that allows you to purchase insurance through your job. And if you're unemployed, that means that you have actually no way of being able to get on insurance, which means that you're probably relying on emergency care, which means essentially no preventative care. And if you're undocumented, unless you're in a state that does provide state level Medicaid insurance, you again have no pathway to getting on insurance, which makes your healthcare, exorbitantly expensive. We also want to address chronic conditions, like diabetes, heart disease. Our communities are unfortunately, more prone to having these issues, which we can thank the British for. And that is something that, I think people are starting to talk about it now. I know Senator Booker introduced a bill like around heart health for South Asians. But this is still something that we need to, when we're talking about healthcare access, it's not just emergency room or abortion care or reproductive care more broadly, but also like long-term health. And then lastly, even if healthcare is affordable, we have to make sure that people who don't speak English as their first language or maybe have limited English proficiency are able to communicate with their healthcare providers. So language access. And then also mental health care, right? Like mental health is unfortunately something that is still stigmatized in many of our communities. And so we want to make sure all of these things are accessible for both uninsured and underinsured immigrants. Then affordable housing and anti-gentrification. So making sure that, everyone is able to afford a home, and especially in high cost cities, making sure that low income renters are not displaced by rising housing costs or discriminatory landlord practices. And then we also, education, I think, is kind of one of those areas where you do see the most significant disparities. The model minority myth says all of us are highly educated and super successful. And some of us are highly educated and super successful, but there are many in our community who did not have the same access to higher education. So we do want to address student debt and lack of access to higher ed for our low income South Asians. And then we also want to challenge that model minority myth because I think a lot of times people don't want to challenge it because it seems like a positive stereotype. Like, who wouldn't want to be called like smart and rich? And yeah, obviously that does feel nice, but that erases the economic inequality within the community. And, by perpetuating the model minority myth or letting it stand, we are essentially putting out a single story for our whole community when there are people with such diverse backgrounds. And their stories deserve to be heard. And then we also want to promote investment in education, job training, and small business support, particularly for marginalized subgroups. And lastly, underscoring all of this is gender and queer justice. Economic justice also means supporting South Asian women, queer, and trans people who are facing compounded barriers like the wage gap that I mentioned earlier, care burdens, and employment discrimination. And so after I talked about what economic justice is, just a small caveat about what economic justice is not. It's not just about increasing economic or income or wealth for all South Asians. It's not enough to celebrate our economic success in tech, medicine, business, while completely ignoring the internal inequalities that exist within our communities. And this is not to say that, ourselves who are immigrants or our parents or previous generations, that their hard work and sacrifices don't mean anything. What it does mean is to acknowledge that our experience is not necessarily representative of our whole community. And if we are going to advocate for our community more broadly and do it correctly, we have to advocate for all of us. And so, how to get engaged? We are the most well positioned to educate our family, friends, and communities by combating mis and disinformation and promoting civic education. We are the people that need to tell all of the uncles and aunties in our life that what they read on WhatsApp is not true. Because hearing things from your loved ones, from your community, is the best way to educate people. They may not believe what they hear. They may not believe if someone else is telling them, but they might believe if someone close to them is telling them. And you'll be able to make it intelligible for them, whether that's saying it in their language, relating it to their life, to their situation. We have the power to make all of this knowledge language accessible and culturally relevant for our communities. And we also need to push for policies that make the entire system better. So, like what I was sharing before about how solidarity is the pathway forward, we have to push for systems that are not just going to benefit the most privileged. We can't settle for elite only solutions. The solutions that we do want to advocate for are ones that are going to elevate the voices of, working class, queer, trans, undocumented, caste oppressed South Asians, and ones that will ultimately benefit the most marginalized folks in our community. And lastly, as I've said many times, broken record, build solidarity. we have to show up for others because otherwise, like, how will they show up for us? So if we want people to, come to a protest about, let's say, caste discrimination or come to a protest, for undocumented South Asian immigrants, we have to show up to their protests for trans rights, for, labor rights. Showing up for others is how we build community and get them to show up for our issues as well. And that is the end of my presentation. So I know we're a little bit over time, but I think we have some time for questions or anything. And I believe that Noel and Anmol will be following up with some economic justice related resources from NAPAWF.
Thank you so much, Sydelle. That was a lot of wealth of information. I definitely learned a lot. Do folks have any questions while we have Sydelle? Like Sydelle mentioned, we will be sending a follow-up email with the recording, with the slides, and some resources from both SAFA and NAPA. But can you see?
Yeah, perfect. So yeah, as we wrap up, we wanted to quickly share some new resources that SAFA has released. We recently published the Climate Change in South Asian Communities Toolkit, and the CAST is a public health issue, a resource guide for advocacy and action toolkit. Both of these can be found on our website, and we'll also be dropping the links in the chat. So we invite you to check them out, and please do share any feedback that you might have. Also, we're really excited to announce SAFA's upcoming gala and conference that's happening this November. So this will be a chance to connect with others in the field and continue these important conversations like the one today. So we'd love for you to join us, and more details will be shared soon through our newsletter and social media pages. So please keep a lookout for that. And finally, a massive thank you to Sydelle for sharing their time and insight with us today. We'll go ahead and share the recordings from today, as well as some resources. On the slide, you can find ways to continue to stay in touch with SAFA. And again, thank you all for joining this Thursday, and we hope to see you at future events. Have a good evening, everyone.